Sushma, a medical student from Janata Foundation School of Medicine. Today I am here to show how to measure the blood using for measuring the blood pressure is stethoscope and sphygmanometer. Choosing the correct and appropriate sphygmanometer is must. For the reference, the width of the curve should not be more than 40% of the arm circumference. The length of the curve should not be more than 80% of the total arm circumference. This is the manometer which will be used for measuring the cuff pressure. This is the bulb which will be used for inflate the cuff. This is the valve which will be used for releasing the pressure in the cuff. So the correct and the standard cuff is 12 into 23 centimeters. The patient should not smoke or exercise or consume caffeinated drinks. Make sure the room is quiet and comfortable. Let the patient rest for 5 minutes and sit on a chair, feet on the floor. The arm selected should be free of clothing, lymphedemas from the axillary nodes and radiotherapy. Palpate the brachial artery to confirm the viable pulse and position the arm at the heart level. If the brachial artery is below the heart level, the blood pressure reading will be higher. If the brachial artery is above the arm level, the blood pressure reading will be lower. Hello, myself Paseddula Sushma, a medical student from Janata Foundation School of Medicine. Can I know your name and age, please?
My name is
And what's your age?
age 50.
Okay, that's good. Now I'm going to check your blood pressure. Is that okay for you? Right. Before going to measure your blood pressure, I'll be tying this curve. It will be little discomfort. Please let me know if you feel more discomfort. Is it okay? I'll be asking some questions before measuring your blood pressure. Did you exercise?
No,
Okay, that's good. And did you consume any caffeinated drinks or any coffee tea? Okay, that's good. Rest for 5 minutes. Then after that, I'll proceed with measuring your blood pressure. First, palpate the brachial artery and then palpate the radial artery. Now, make sure the patient arm is cloth-free. Avoid talking to the patient when measuring the blood pressure. With the arm at the heart level, the lower border of the cuff should be above 2.5 centimeters above the anterior cubital creases. Now, slide the two fingers slightly to know whether it is loose or tight. Before inflating the cuff, check that the bulb of the valve is closed. First, estimate the systolic pressure by palpation. As you palpate the radial artery with the fingers of one hand, rapidly inflate the cuff until the radial pulse disappears. Read this pressure on the manometer and add 30 mmHg. Now, position the stethoscope bell over the brachial artery. Make sure the bell is heard. Because the sounds to be heard, the Korkov sounds, are relatively low in pitch. Now, inflate the cuff again rapidly to the target level and then deflate the cuff slowly at the rate of about 2 to 3 mmHg per second. Note the level when you hear the sound of at least 2 consecutive beats. This is your systolic pressure. Then identify the diastolic blood pressure. Continue to deflate the cuff slowly until the sound becomes muffled and disappears. To confirm the disappearance point, listen as the pressure falls another 10 to 20 mmHg. Then deflate the cuff rapidly to the zero. The disappearance point, which is usually only the few mmHg below the muffling point, provides the best estimation of the diastolic pressure.